Hello everyone, welcome to InnoHealth Conference 2024. I am Ursina, your host for the InnoHealth Magazine podcast. Today we have the honor of having Dr. Ramindra Kalra. So ma'am, would you like to just give a brief introduction of yours?
Yeah, I'm Professor Dr. Ramindra Kalra, working as Principal, Holy Family College of Nursing, and I'm a person with background of 39 years as a nurse educator in different posts, and the founder principal of Holy Family College of Nursing.
That's great to hear from you. So as ma'am, you mentioned that you are a nursing educator. So do you think that there is a need of revision of the curriculum of the nurses so that we can get in the pace of the AI and the advancing technology?
See, as you said, the revision in the curriculum is done just 4 years back only, and the first batch of the students will be coming out in some of the universities by 2025, and Delhi University, where I am associated with, it will be 2026 that the first batch will come out. And definitely there, AI, digitalization, there's a separate paper. We had computer science earlier also, but now we are talking more on terms of digitalization, and there are some elective subjects also where the students can opt for. The revision is already done. The gap where it exists is that the nursing faculty also need to be trained on certain aspects. The students that we are getting right from the beginning, they have learned computer. I know my granddaughter, who is just 9-year-old, with certain things she's so comfortable. You know, when she talks about Lego and other things, I need to look into and then pick up from her also. So the student generation which is coming up, they are friendly with it. And I think that this part of information and technology needs to be updated frequently. Maybe it may not be possible for the curriculum to be revised so frequently, but at the college level, we do take care of that it is implemented. And our hospital, being a private hospital, we have the digitalization, we have our own hospital information system, and so they're being prepared right from the time that they enter. They are being taught how to enter into the patient's record, how to access, and the time has reached that sitting in an office, a person is able to access all the records of the patients. So that is making change. But yes, at the same time, I think somewhere we need to be educated on, if the things are so easy, the students are so familiar, they are given an assignment, they go and get it from ChatGPT.
Exactly.
Right? So we really need to be careful, we need to be more updated on technology. We can help us to make it, whether it is through ChatGPT, or there may be another student who's really working very hard, but her assignment may not be as good as the person who has just copied from ChatGPT. But there is a problem there also, because ChatGPT may not be able to really put the things, that may be segregated. How do I interpret is very important. So those things, I think faculty also needs to be updated on it.
So when we talk in terms of the nursing profession, so how the sustainable ecosystem is being created in nursing profession when it comes to AI and tech?
See, the nursing students right from first year are working in a hospital setup. It's not that during internship that they will be going to the hospital. So right from the beginning, they are working in the hospital. They are already familiar with the computers. And now there's another thing we have with one of the companies, I should not name here, that we are developing the entire curriculum in software, where the students will have access of all the lectures of all the complete curriculum is in a software. They can go, they can log in, and any topic that you want to revise, everything is there, and that is there with the pictorial and with the videos also. We have helped that company to develop that, so we know what is the content. What is expected is that the students will be having access to that. The teacher tells them that we are going to discuss this topic tomorrow. The students are expected to read and come, and in that software teacher can make out how many of them have opened and read. So when they come, they have the basic knowledge, and we can go for a higher level of education, because there will be definitely students who will have a lot of questions once they have gone through. So the level of education is going to go high with that. This is one example, and definitely there are so many things available now that we can make it so interesting. It is not now it is lecture method is outdated method, but at the same time we need to keep in mind that we should not get so much digitalized that we are teaching the patient care also sitting in the classroom, because each patient is an individual. We are all human beings. I may be suffering from one problem and you are suffering from similar problem, but the way you have to be treated, your way of dealing with the problem, and the way I have to deal, I am taking my illness, maybe huge difference. So they have to understand individual differences. They have to be at the bedside. They may be monitors. We talk about all big monitors that the nurses need not go to the bedside. They can look at the monitor and provide the care from there. But I need a human touch as a patient. Fine. That's why in Holy Family Hospital, this was a COVID hospital, and I can tell you that the quality of care, that was one of the best hospital in providing quality care. We as nursing faculty have worked, our students have worked with the patient, and each nurse has gone to the bedside. There was no difference in going to the bedside providing care other than that they were in PPE. So the patients, that amount of satisfaction with the patients got, and later on they came back to the hospital saying that this we have not heard anywhere, because most of the places complaint was nurses would not come to the bedside, doctors would not come to the bedside, they will be remotely looking into us. And we are privileged that we were able to save all the lives of our healthcare professionals. We did not lose any healthcare professional in spite of being at the bedside. That's a big achievement. So that individual care, the touch, compassion, empathy, that has to be there.
Great to hear that. Would like to ask one thing more, that when you compare the academic institutions in a developed and a developing country like India, so what changes you see in the nursing profession?
As compared to Western countries?
Yes.
See, India, I'll say, is really doing very well in nursing education. If you are doing according to the INC curriculum, if you are maintaining the student faculty norms, if the faculty is going to the clinicals and teaching, it's a wonderful syllabus. My students, when they're going abroad, they come back and tell that, Madam, I'm working as an ICU nurse. I am prepared so well to look after all the patients. But my fellow nurses from other countries, even from UK, they are trained in they are trained in medical surgical, but they are not trained in pediatrics. They are not trained in maternity. So they are not able to do all that. The amount of the access to the patient, because we are there. The person who's teaching in theory is also in the clinical. When I talk to people from US, my fellow colleagues, nurse educators, they say that we are only for the college. We have separate group of nurse preceptors who go with the students to the clinical. So there's a huge difference. Because if I'm able to maintain the continuity of being in the theory, with the theory and clinical, I can have the student better than a person who's exclusively with the theory or exclusively with the practical. So, plus we are giving more freedom for the students to work with the patients, taking the responsibility, being with them. So I think we are doing wonderful in nursing education.
Last but not the least, I would just ask you to share some message to our dear listeners.
Nurses are doing a great job. Only thing is that they need acknowledgement. And my request to my fellow colleagues is that do the best that you can do. Keep yourself in the place of the patient, and you won't mistake. If you are remembering this, you will be wonderful nurses, and it is not going to stop with 4 years of education. It has to be continuous learning. Even after 39 years of job, I still have that craving that I must learn new what is coming up in nursing.
Thank you, Dr. Ramindra Kalra, for being here and being in the podcast today. Thank you so much
It
for
was
your
my
time and
pleasure.
efforts.
Thank you so much.
much.